Ni hao. This is the only word of Chinese that I know apart from CCA, which means thank you. So, we are in Shanghai, 24 million inhabitants, 80 million if you take all the suburbs into account. That's the size of Germany, 450 primary health centers, hundreds of social medical centers. It's an entire country. This city is like an entire world. And Professor Fuchu is a specialist in AI. So, dear Fuchu, a patient comes to your hospital. How does his consultation with the AI takes place? Does the patient has an appointment? Can he or she come without an appointment? Do they fill in a questionnaire or survey on a tablet? What are the screenings or examinations? Is there any medical or nurse, medical presence or nurse to support the patient? First of all, I'm very happy to be here, and I thank you for inviting me. Thank you, Dr. Valencian, for this invitation. Before coming to the hospital, the patient can take an appointment online for an online consultation with an AI doctor. If the patient is young enough, he will know what to do. If he's more aged, our nurse will support him in filling in the questionnaire. Some questions will be asked, and the question will have to answer the questionnaire. And depending on the result given by the algorithm, the AI will suggest some further screenings and give a prescription for the patient. Further screenings will be done, and after the result, depending on the result of the screens, the AI will intervene again and suggest other treatments or further screenings. This will be submitted to a doctor who will confirm or adjust the treatment suggested by the AI, and then the doctor will sign and confirm the diagnosis. The nurse is on the spot to help the patient, especially if it's a first visit. Otherwise, the patient is able to do everything on his own. So you still need a doctor. It's not the AI doctor on its own. There is a doctor, and the doctor confirms. Yes. The AI is not able to replace a human doctor at present, so we still have presence working in the background to control the work of the AI. If there are some mistakes, they will be corrected by our human doctor. The prescription is signed by the human doctor, not by the AI doctor. The responsibility is on the human doctor. On a legal frame background, the AI is not responsible. So you have doctors 24 hours a day, 365 days a year in the hospital to work with the AI. Yes, in our hospital, we have technologies such as human body language recognition and a human machine interface. A human doctor cannot be there 24 hours a day, but we have several shifts, and doctors work in the background to correct the IA. Out of 365 days in the year, we have doctors in the background for the AI. Patients trust in our hospital, but they place more trust in the human doctor. The AI is there to support our doctors. This is why patients keep trusting us. Those doctors receive a specific training for the AI, or are they not acquainted with the functioning of the AI? Yes, our doctors received a specific training when the technology was installed. The company which develops the AI provides the training. Then the doctors will be able to train other doctors in turn. Error is human, but the AI can also make errors, and the system authorizes the human doctor to correct AI's mistakes so the machine can learn from the mistakes as well. Do you also organize remote consultations with the AI for people who live in remote areas? Yes. Not only do we use the AI in our hospital, but we also use it on our internet hospital. For instance, for Tibet, in Tibet, we have a connection center. From our hotel, we can get in touch with the medical center of various communities which may be very remote, and we can help their local doctors to master that type of technology. We use these techniques to train the doctors who work in proximity medical centers. During the consultation, our AI can provide some support, and this gives excellent results, especially for local medical centers. The AI helps them to be more efficient, and this is true for specialists as well. The AI can be extremely useful for doctors, whether it be for GPs or for specialists. How many patients did benefit from a consultation with the AI? For both types of consultations, with GP and specialist consultations, and since it was put in place a year ago, we had about 92,315 consultations, 47 and 940 consultations directly with the AI, and 44,000 with the AI via internet. How do you evaluate the results? In the beginning, doctors were not familiar and patients were not familiar. After 1 year, the acceptance by doctors and patients is quite satisfactory, so we will probably have ever more consultations. Can you share the medical file with other hospitals? Can the file be connected with hospitals from Beijing, Hong Kong, Nanking, or other cities? Yes. In the city of Shanghai, we have a platform managed by the National Commission of Health of the municipality of Shanghai. On this platform, the medical centers and major hospitals upload all medical data, and they can be exchanged. But outside Shanghai, this is not taking place. It is only available in Shanghai as of today. It is not possible in Hong Kong or other cities now. What about personal data? As you know, for us Europeans, it is very important. We are very focused on that. So, is there any protection of data with this system in China? Yes, this is a very important question. The architecture of our platform is compliant with professional standards. We have protection measures reasonably so as to avoid that this data be used, consulted, modified or damaged or lost. We use various protocols to secure the exchange of data between individuals and the platform. For navigation, we use the protocol HTTPS. So every data is encrypted. This is a technological answer. Apart from that, we have reinforced our management. It is forbidden to access the platform without authorization. Thirdly, within our platform, we have an internal control system. The staff has access to this platform with a certain level of authorization. We also have a surveillance system which is aimed at our staff. We also organize awareness campaigns so that our staff members keep fully aware of the legislation of any country. So we work in order to protect the personal data of patients. So your data cannot used inappropriately, that's fine. What were the reluctances and the obstacles to the deployment of these techniques? Did you have some resistance within carers, patients, administrations? How did you overcome that? The greatest motivation is to raise the efficiency and spare time and spare human resources. The constraints were, first of all, for patients because they are not familiar with AI technologies and they don't know how to access such services. For doctors, to begin with, they were quite reluctant. They did not know how to use it. They had to be trained, especially aged doctors. For the administrative services, it was an extra burden. They had to manage consultations within the hospital as well as online consultations. So we made sure that the platform be compliant with the medical processes and habits. Patients are supported to access in accessing AI services. This is how we have overcome the difficulties and we've been able to promote the system. I hope that you and all the delegates here will be able to visit our city one day so as to see what you can do with AI. Thank you. Thank you so much, Professor Suchu, for these explanations.